Hey, good afternoon, everyone. Oops, excuse me. Good afternoon. Thanks for joining me. This far into the game, if you don't know who I am, I'm Jason Mower. I'm with the Sheriff's Office. I'm also acting as the Chief Information Officer for the Sweetwater County Emergency Operations Center. I have an update that I'd like to start with just from the EOC. I think maybe some of these details get lost in the information overload that we're all experiencing lately. Obviously, one of the most important things in a public health emergency is one of the most important things the Emergency Operations Center can do is help facilitate that all of our local agencies are receiving adequate, proper personal protective equipment, or PPE. So in the 3 weeks since we've been active at the EOC, I think we've put a lot of things in place. We've done a pretty good job. We've set a lot of things in motion, and that has been and continues to be a priority. And I would just like to share some numbers. Since we started distributing locally PPE from the EOC on Monday, April 6th, as of yesterday in total, we have delivered over 1,590 N95 masks, 3,810 procedure masks, 730 isolation gowns, 27 boxes or approximately 2,700 pairs of non-latex disposable exam gloves, 50 face shields, and all of those supplies have been distributed through the EOC to over 20 different entities throughout the county, to include the hospital, the medical centers, home health, assisted living, et cetera. At the Sheriff's Office specifically, we've also been for, I don't know, a couple weeks now, around the clock, making use of a small collection of 3D printers. And I'm told that currently we have manufactured about 100 N95 masks through the 3D printing process that are ready for distribution. Also, we are beginning to actively explore perhaps printing components for face shields and manufacturing face shields in-house. So that was kind of a logistics update from the Emergency Operations Center. I want to share that because PPE is critical in a public health emergency. For members of the public that are tuning in on Facebook or YouTube, if you're interested in donating to the EOC, we're looking for a specific list of items that I'm going to share with you as it relates to PPE. And we now have three collection sites set up for these donations. One is in the designated canister near the front doors of Sweetwater Memorial. The other is at the front doors of Castle Rock Medical Center in Green River. And then finally, there's a designated area in the parking lot of the Rock Springs Chamber of Commerce. Also, feel free to call ahead to any of those places if you have any questions or want any clarification. But officially working together through the EOC, the list of PPE that we have identified that we would love donations is as follows: non-latex disposable exam gloves, N95 masks and respirators, surgical masks, face shields, goggles, gowns and isolation gowns, safety glasses, cloth masks, hand sanitizer, and disinfectant wipes. So with that, if I might, some of you may have, in yesterday's situation report, read a message from Sheriff Grossnickel, RSPD Chief Dwayne Pacheco, and GRPD Chief Tom Jarvie. I want to thank them for preparing that message. Sorry. So the message from the chiefs and sheriffs yesterday that went in the situation report, I just wanted to take a moment, and for those who didn't see it, the punchline is basically this, that it's critical right now. We can only act on information that we have, and what we know is that increasingly there is data to suggest that social distancing makes an impact. And speaking as a cop for the last 11 years, I want to assure the public, we remain frustrated. We're frustrated because in our personal lives, we're out and about, commuting to and from work as necessary, because we have to still come to work, and we still see carloads of kids. We're still responding to large gatherings, bonfires, kegers. No one, and I'm confident that I speak for both the sheriff and the chiefs of police, there's not a soul in uniform with a badge in Sweetwater County who wants to turn our community into some sort of police state. We don't want to write citations or arrest people for breaking curfew or going to the park or going to grocery stores. But the frustration is that we can only act on the information that we have. And the information that we have right now is what we're doing is working, and we need to continue doing it. And in that respect, ladies and gentlemen, our shared responsibility as friends and neighbors and family in Sweetwater County trumps our personal choices. And by that, I mean, whether you're willing to accept it or recognize it or not, your personal choices have the potential right now to affect other people's lives. It's our shared responsibility to continue with these practices that have disrupted everything about our lives, that annoy all of us. No one wants to stay home. No one likes not being able to go out with friends. No one likes not being able to go out and have a meal at a restaurant. No one likes not being able to go out to the bar for a drink. But we have a responsibility together, and we're doing it so that we can keep it from destroying our community here in Southwest Wyoming, so that we don't have to face choices where our hospitals are overwhelmed and our medical professionals and healthcare providers are forced to make really difficult decisions about life and death. So with that in mind today, the purpose of today, my guests today are co-owner of Santa Fe Southwest Grill in Rock Springs, Cory Gardner. Obviously, Cory went public with his announcement a few days ago to close his restaurant after a COVID exposure there. And a lot of people know and respect Cory as a community member and local business owner. And I know that he's been personally and professionally affected. And I think it would be helpful to everyone watching to hear what Cory has to say in his firsthand experience with this situation here locally. And then also joining us today, and I'm really grateful for this, it's our patient number 8 in Sweetwater County, confirmed positive, self-isolating at home. I'll let him introduce himself when we get there. And then also for any public health specific things that might come up, joining us is Sweetwater County Public Health Director Kim Lionberger. With that said, as always, just by way of clarification, members of the press that are part of this webinar, if you have a question, please one person speak at a time. You guys always are doing a great job with that. We appreciate it. I appreciate your professionalism in that regard. One person at a time, and please, because we are streaming on various platforms to the public, identify yourself by name and organization. Does anyone have any questions for me before I turn it over to Cory? All right, Cory, go ahead. Thanks for agreeing to come on.
Oh, no problem. Thank you for the opportunity to speak. I really appreciate it. What I can start off doing is just giving everybody a brief chronology of events as they happened, as we became aware of them. Again, like I stated in our post, we were always taught, my business partner and I, we've been best friends since high school, and he's like my brother. And we were always taught by our folks, you know, honesty is the best policy. And you know, we love our community. We always say on all of our posts that we love our guests, we love our customers. It's absolutely the truth. We grew up here. We know it. All you guys we see in Walmart, we see out at the restaurant. You know, we love our community. It means the world to us. There's nowhere else we'd rather be. So that being said, roughly around April 1st, April 2nd, we received a call from one of our associates that said that they had a family member that had tested positive for the COVID virus. And they had called in asking our manager what they needed to do and if they need to come in. We said, certainly not, stay at home. And we went through, we sanitize everything on a daily basis anyway. And even things such as the iPads we use, I mean, we sanitize them in between taking them out to the parking lots. I mean, each guest gets a nice, clean, sanitized iPad to sign on. And we felt like we were taking all the precautions we could. And so we continued to do that. And about a week later, we heard from this associate that they had indeed tested positive as well, which kind of surprised all of us because this associate had no symptoms and had never had symptoms and continued to have no symptoms. So I think it surprised them as well. So Shane and I put our heads together and we found out late Thursday night, which was the 9th, and the day before Good Friday. And so we put our heads together and thought, you know, what should we do? Well, let's err on the side of caution and we'll just make sure that we close for this weekend. And we tried to think of who could possibly have been exposed. And we took those 2 kids and we had them tested. And unfortunately, they both came back positive. 2 of those boys, well, the one boy is my son, and he'll introduce himself in a moment. But my older son is roommates with the other individual that tested, and so I knew I was going to have 2 boys test positive, and it was a real eye opener for me because we had done everything humanly possible. I mean, of course, we wanted our business to continue to thrive during this time. It's like all business owners. I mean, we're wondering how we're going to meet our bills, and we had lots of kids that were volunteering. That, I mean, we're like a family down there, and a lot of them just said, hey, you know, we don't care if we're getting paid or not. We just want to help. And you know, they'd come in and help us and volunteer as best they could. And we thought we were doing everything right. And so when something like this happened, it was just a shock, and how fast it had affected my own family personally and my business. You know, from just watching it a few months ago on the news, seeing that there was, you know, 5 or 6 cases in the whole US, and all of a sudden it was on my front doorstep. You know, it was just, it was a shock, to say the least. And then I'm worried about myself and anybody that I've come in contact with, anyone that my associates have come in contact. And that's all in addition to the stigma that is attached to, you know, the restaurant and to my family. I mean, when those first people come out and are labeled a positive case, I mean, I think everybody, myself included, was kind of like, whoa, you know, I mean, and it's not like they did anything wrong. They were just in the wrong place at the wrong time, happened to pick up the virus. But again, it's got such a stigma attached to it, just kind of freaks everybody out. So we went ahead and we closed the restaurant down. Everybody got tested. And I can't speak for individuals, but as a whole, I can tell you that we just got a bunch of negative tests back. Thankfully, you know, we did a lot of praying and we continued to use the safety measures that were instructed to us by the task force and the people that had called us. And bottom line is we're all still basically locked away in our houses to basically treat it as if we are positive, because from what I understand, and I know information changes probably on an hourly basis for these folks, and I don't know how they keep up with it, because if I had to run a restaurant that way, I'd pull all my eyebrows out, but somehow they do, and they go with the best information they have. And that is that, you know, whether you're positive or not, if you've come in contact, you have to quarantine. And so that's what we're continuing to do. And all the kids at the restaurant, they're all in good spirits. My boys continue to isolate. Thankfully, their symptoms aren't severe at this point. And, you know, and I just want to say too, for whoever's watching, we're so thankful. When I put that post on Facebook, I honestly thought we were going to get skinned alive. I was just waiting for the backlash, you know, from every person that had picked up a Santa Fe tortilla chip in the last 2 weeks was going to, you know, grab a pitchfork and a torch and be at my door. But, you know, that's not the response we got. The response we got from our guests and our friends was just one. Honestly, it brought me to tears, because they were just encouraging and telling us how much they appreciated that we did what they felt was the right thing. And they just had more respect for us for that. And honestly, we love our community. Like I said from the beginning, Shane and I want to do anything to affect our community in a negative way, not only because we've worked so hard for 30 years to build what we built, but we have people in our family that have underlying health issues. My wife, she's got terminal brain cancer, and she, you know, I don't want her getting sick, obviously. You know, my partner's boys, they have one of them has cystic fibrosis. Both of them have Hashimoto's. It's a very rare disease that does affect them respiratory wise. We don't want those boys being affected. I mean, I love them just like my own boys, and they mean the world. So I guess with that being said, we're just thankful that everybody was so easy to work with. Jason, you and Kim and all the other people and the doctors that have helped us. You guys have all been awesome. And you know, I'm just happy to try and help any way I can to make people aware, because none of the kids at the restaurant wanted to spread this. I mean, nobody was really worried about themselves from the beginning, but everybody was concerned about their family. Everyone was concerned about that one person that they know that is compromised in some way, that seems to always be the people we hear about that, you know, lost their battle with this virus. And those are the people we're all concerned about. So.
Thanks, Cory.
Oh, absolutely.
Does anybody have any questions for Cory? Okay. Hearing none. Let's turn it over to Cory's son, Parker. Parker, thanks for coming on. Thanks for being here.
Thank you for having me. I'm Parker. My dad is Cory Gardner, and I was a patient to test positive for COVID-19 in Sweetwater County. And it was weird when it all happened. Like, of course, I don't want to get anyone else sick, so that's why I'm isolating. But like, I followed most of the rules. Like when I was with my mom and stuff, we would go to like Walmart, and I would wear like the mask and everything, and I would sanitize everything before I touched it, because I don't want to give it to like my mom or like my little sister, or even like my stepmom or Brax, my cousins. They just all matter to me. And of course, I don't want to get them sick, so I follow like the CDC precautions that you're supposed to follow. And it's just really weird that I tested positive, because I didn't think it would happen. You know, like it's such like a long shot that if one person had it, then it would pass over to another and then pass over to another. And so I didn't really think I had it, because my allergies go crazy around this time, because it's spring and there's like pollen in the air. And I just assumed it was allergies because I get really bad allergies. And it turns out I tested positive. And when I first heard it, I was like, oh, okay, so like that's a thing. Like I didn't expect it to happen. And so from there, ever since I tested positive, I've just been chilling in quarantine. I've been doing a lot of homework, and I've been playing a lot of video games online, like multiplayer with like my brother and his roommate. And honestly, it's been really fun. Not the corona part, but like the bonding part, you know, because I feel like I'm getting closer with like my brother, and it's just a weird experience overall, you know. And when I was told I needed to get tested for it, I was like, oh, like if like if I do test positive, then like what happens now? You know, like what happens to like the restaurant? Because I didn't want anything to happen because I didn't want it in the first place. So I just feel I feel bad that it ended up having the effect it did, if that makes sense in a way. And I know like I didn't like ask for it. I wasn't like, hey, I want the virus, you know? And I don't know. It's I'm just haven't experienced anything like this, so I don't know like how to react, and like I don't know what steps to take to act upon it. So I've just been following what the doctor said and just staying at home and making sure that I don't have contact with any other person. And well, yeah, pretty boring.
Parker, how long have you been in self-isolation now?
Um, Today is day 4.
Day 4.
Yes.
And can you tell everybody what the illness has been like for you and how it's changed and what symptoms you have now? And
Yeah. Probably and yesterday are probably like one of the hardest because like my eyes have been like really hurting, and like I get like slight pains right here when I like need to breathe, and they usually fade away around noonish, but in the mornings when I first wake up and everything, it's just it just hurts. But then like I take some Tylenol and then I get better, and this has happened yesterday too. And I've just I don't really know if I have a fever yet because like we don't have a thermometer, but like I can feel myself getting hot. If that makes sense, like you like sweats and stuff, and it's like 60 degrees, like it's freezing in this house, but I'm sweating, which and my throat has been a little like raspy and like it hurts, and I have a cough. I'm very congested. I had a head cold like yesterday and today, and it's just like mainly in my ears where everything like feels clogged. And like you know when you're having like a sinus infection and then you go swimming and then you like dive to the bottom of the pool and all that pressure just hits, that's what I've been feeling. And um not much has changed between here and now and yesterday, but I feel like I'm at like that peak where like it wasn't that bad, then it's getting like really bad, and then I'll just come back down and everything will be fine, hopefully by the end of the 2 weeks.
man, I thank you so much for sharing that with us, Parker. I really appreciate it. I think there's a lot of people out there for different reasons that is just awesome. We're
And it's
sorry.
really weird. Sorry, go ahead.
No, you're okay. It sucks that you're going through with it, but agreeing to be a part of this and give our friends and neighbors here some insight into what it's been like for you. I think that's
Yeah.
super useful telling.
And if you and like to the people watching, like if you can just like stay home, because if like the symptoms are like a lot like what I said, like I just thought I had allergies, but I didn't. It wasn't allergies, it was COVID-19. So if you can just stay at home, don't go like you need certain stuff from like the store or like things that you really need. And if you are not feeling well, just like have a runner, I guess, to go get your stuff, leave it on the front porch, and make sure like you sanitize everything before, because you don't want it like given to other people, if that makes sense. And yeah.
No, thanks again. Does any members of the press have any questions for Parker?
Yeah, I've got one for you, Parker, if that's okay. Braden from Sweetwater now. Just kind of wanted to ask you about your testing experience. What was that like?
It was definitely something I wouldn't want to experience again, because they have like this Q-tip looking thing and they have to like shove it in your nose. And she said that like from like your earlobe to like the side of your nose, that's like an important part, I guess. And then like they put it halfway, so it needs to get back there. And when it happened, when she like shoved it in, I coughed, and I felt really bad because I coughed on her, because it was just an uncomfortable experience. So I coughed on her, and then she was like, "Oh," and I was like, "I'm sorry," and I felt bad. But yet again, she had like a face shield and like a mask and scrubs, so she was fine.
Awesome, thanks, appreciate it.
Yeah, no problem.
Anybody else? Kim, is there anything you'd like to add from your perspective?
Yeah, I think just from my perspective that, they were talking about how they thought they were doing everything right. And I'm sure they were doing everything right. Unfortunately, this virus doesn't discriminate on who ends up getting it. If you've been exposed to it and it gets into your nasal passages, chances are you're gonna get sick and become infected. So just keep doing everything right that to do right. Washing hands and stuff is going to be one of the best practices that you can do to avoid some transmission to yourself. I think the other thing to remember is that the COVID virus is not spread through food in any way, shape, or form. And so continuing to support businesses here that have restaurants that are trying to survive this experience is important. You, again, protect yourself by, if you want to transfer your food into a different container, washing your hands before you eat. There should be no problem with continuing to support these businesses and restaurants. I like how Parker said, stay home as much as you can, because the more you think about who have I been in contact with, that web can get so big if you have been out interacting with a lot of people, and it doesn't just necessarily affect the people that you have been in contact with. It can reach out further into individuals who may be immunocompromised, as Cory has touched on. And then it is oftentimes, like, every case at this point in time in Sweetwater County has been able to be at home and isolate themselves. And that doesn't mean that we're out of the woods, and we're lucky that we only have these mild cases so far, because we've seen recently in the state that there have been 2 COVID-related deaths. And so we have not peaked in any way, shape, or form at this point in time in Sweetwater County. It is continuing to spread. It is obviously community spread, as it's difficult to track where any of these individuals have really gotten it and where it started initially. And so it is out there in the community. Just do the best you can to minimize your exposure to other people that aren't in your immediate family household, and wash your hands, like we've been saying for the last, feels like forever at this point in time. So thank you for coming on and sharing your stories.
Kim, are the state tests, and I'm definitely not a doctor, are they pharyngeal swabs still, or are they nasal swabs?
So they're called nasopharyngeal swabs, which means it goes in through your nose and is pushed all the way back to your pharynx, where it's basically like the back of your throat. And so the testing supplies right now, those are still a nasopharyngeal swab. The new ones that you mentioned yesterday that the hospital had with the Abbott platform for that are very minimal. There's only, I think, like a handful of test supplies that come with that. Those are just nasal. So it just goes right up into your nares, just right. I didn't touch my face for anyone that looked, I didn't touch it, but it just goes right in your nostril instead of having to go all the way back into the pharynx as well. So hopefully that will expand, that you'll get tests back more quicker and that won't be quite as uncomfortable.
So given the limited supply of that Abbott ID Now assay system, who will be priority for that testing method?
I don't necessarily want to speak for the hospital since they're the ones that have that, but I would foresee that being as individuals who are being hospitalized, so that you can get results rapidly, so that anyone involved in their care would be aware from the get-go that they are dealing with a COVID positive patient.
Cool, thanks.
Yeah.
Any questions for Kim?
Yeah, Kim Brayton from Sweetwater now. Do you have any insight as to what testing supplies look like right now in the county? Like, how much do we currently have?
Yeah, so actually I do have a little bit, and so I can tell you the information that I know of related to the viral media transport that public health has received from the state lab. So yesterday we received a shipment of 258 viral media transport and nasopharyngeal swabs. And we provided that to the hospital because the previous amounts that we have provided to Castle Rock, they have adequate supplies and they didn't feel that they needed them at this time. And so in addition to the viral media transport that we receive from the state lab, then the hospital and Castle Rock also have viral media transport and swabs that they get through those private labs that they're using. So if they're using LabCorp will send their own viral media transport and swabs, and ARUP, those types of private labs will also have the viral media and transport and swabs. So at this time, the testing media and the ability to collect a COVID-19 sample is not limited in the community. If someone wanted to be tested and they were symptomatic, they were contact of a positive, there is not a limit necessarily on the actual viral media transport and the swab. The limiting factor is how many tests these private labs accept on a given day. And so there's a couple different physician offices that allow the lab to use their LabCorp accounts. And for instance, one, you can only send out 10 samples a day through a LabCorp account. And so right now the limiting factor would be on how many samples a lab will accept on any given day. And then if a sample goes to the state lab, there is no cost associated with that. However, the state lab does not have an excess of reagents to run the test. And so because of that, the state lab is very specific on who they will run tests for. The private labs don't have that specific criteria to run the labs, but unfortunately that means that then there is a cost associated with a test that goes to a private lab such as LabCorp. Did that answer your question, Braden?
Yeah, it did. So it sounds like it's more, it has more to do with the lab than it does necessarily the local supply.
Correct.
Okay.
At this time, that is correct.
Okay. And then just to follow up with that, have you seen like a increase or decrease in the number of people coming in for tests?
Well, the lab and Castle Rock are the ones that actually do those tests. So I'm not totally aware of their numbers, but I was informed from Castle Rock at least that their respiratory clinics have kind of slowed down recently. But I think the hospital probably still is staying pretty busy, but I don't get actual numbers on how many they see a day. Obviously, Saturday was busy for them as Santa Fe kept them busy on Saturday with everyone that they sent down to get tested. But I don't know exact numbers of who is coming through the hospital.
Hi, Kim. This is Dave with Sweetwater Now. In the wake of some of these more recent positive tests, has the number of presumed positives grown, and what types of challenges are you all facing with contact tracing?
So as far as presumed positives go, off the top of my head, we probably have 4 or 5 in the county right now, and half of those at this point have resolved, and they are no longer, they're fine too. They wouldn't have any restrictions. So there's not a lot of presumed positives associated with any of our positive lab confirmed individuals. That's not to say that there's probably a lot of presumed positives out in the community. So for instance, if someone goes to a private provider, the provider says, oh, I think you might have COVID, but you're not tested, I wouldn't have numbers on those types of individuals. As far as contact tracing and that goes, it is pretty time intensive. It's pretty front loaded as far as getting the information needed. For instance, on Saturday with the 2 that came back positive, I was in the office for about 9.5 hours trying to get everything entered into a state system that EPI can then, epidemiology at the state level can track all of these individuals. You have to issue isolation and quarantine letters to everybody that is positive. If you're positive, you're isolated. If you are a close contact of a positive, then you're quarantined. And so it's fairly time intensive getting that up and just making phone calls, talking to multiple people. So it is fairly time intensive with the contact tracing. And so as much as I'd love to have answers really fast for people on if these are all tied together, sometimes we don't know because it creates more connections that we don't always initially know right away.
Hey, Kim, I've got one more question for you. And I don't know if this is more for you or for Jason, who are here today, but, you know, we've had several messages about like a Walmart employee who tested positive for the coronavirus. And I just wanted to know if you could confirm that or not. And, you know, what does that mean if it is true?
So at this point in time, I would say that it's your best bet to assume everybody at Walmart is positive, just because you just need to keep yourself safe. So whether or not we have a confirmed one or we don't have a confirmed one, going to Walmart is something that you would definitely be aware of to maintain a distance and wash your hands, regardless if we have one that has worked at Walmart or not. With that being said, if we are doing these contact tracings and anyone is identified as a close contact or that you need to be concerned about, you are definitely notified.
Okay, great, thanks.
And I'm not just singling out Walmart. I would say the same thing for Smith's and Albertsons and, you know, any type of public area. You're kind of, those are where you need to be extra cautious.
Yeah, I guess we've just had, you know, concern from some of our readers about that, you know, just going out, you know, you don't know. And I guess you're right, you know, it does go with everyone, but, you know, an employee that's spending an 8-hour shift there, you know, there's definitely concern there, so.
And like I said, if you were identified as a close contact, which is someone who has spent more than 10 minutes with you, less than 6 feet apart, if anyone that is lab confirmed positive or presumed positive because they have symptoms and they were in contact with someone, you would be called, you would be notified.
And let me just ask you this, like, you know, if there was a case that was positive at Walmart, would that be released to the public?
No, not necessarily. There's HIPAA to consider. There's people's privacies that we are very careful about not identifying. If someone that worked at Walmart and was positive wanted to release that information, I couldn't stop them. I wouldn't tell them not to do that. But if you were someone that needed to be concerned, you would know.
Kim, I actually have a question if you don't mind me asking.
Go for it.
So if you let's say like you have a fever now, how long should you wait before you actually go and get tested? If it's just a little fever and you've had contact with someone.
I would say at this point in time, with the ability to test individuals, I would go get tested. So if you were feeling yucky, I would go get tested.
Okay, cool. Thank you.
You're welcome.
Anything else? Does anybody have any final thoughts?
Yeah, I just wanted to, Kim, again, can you clarify for me, going back to your comment about, you can, the 10-minute kind of mark that you were talking about, so are you inferring that you can't catch it under 10 minutes?
Say that again, Braden.
So just going back to your comment about like the 10-minute time that you're with someone, is that, let me think how to rephrase this. So if you're with someone that is around for 10 minutes or more, are you going to necessarily still catch it?
Okay, so if I understand the question, if I am hanging out with you and I am COVID positive and we've had a 15-minute conversation 2 feet apart, are you going to get COVID? Is that what you're asking me?
Yeah, I just wanted to clarify what you meant by that 10 minutes.
There is a potential that yes, you could. So as I'm talking and breathing, the droplets could come out aerosolized. You could be close enough that then you're breathing those in. And so, yes, there is a potential that you could become infected with COVID if you hang out with me, who is COVID positive, closely for over 10 minutes.
Okay, and under 10 minutes, is there still a chance?
It would be minimal. It would be like, I need to go to the grocery store and I'm checking out and I'm kind of close to this person, but it is for a short amount of time. Like, those are the kind of people that we would not start an investigation on you if you were positive and you went to Smith's and you had a interaction with a checker that was not very long. Those type of people we wouldn't even consider interviewing.
Okay, perfect. Thanks for clarifying that.
You're welcome.
I guess the question, Kim, is where did the 10-minute rule come from? Is it based on CDC recommendations or testing data or what we know about transmission of the virus to date?
Right. That's based on the state guidelines that they receive from CDC.
Cool. Thank you.
You're welcome.
Anyone else? All right. Well, I want to thank everybody for tuning in. I hope this was useful. I thought it was important. I'm so very grateful to Cory and Parker for sharing their story with us. Like I said, I hope a variety of people out there for different reasons got something out of this today. So I appreciate it.
I'm sorry, may I say something?
Absolutely.
This is, I guess, just the final thought. I mean, I've seen on the news a lot of things about, Florida, for example, had big party, 400 people busted the other day. And then you see things on the other coast where, there's one guy out there on the flip side of the people. You're looking at law enforcement and they're ticketing some guy that's out there paddleboarding by himself. And I guess what I look at is California, New York, Florida, this isn't it. This is Sweetwater County. And in my mind, because this has all been dropped on my doorstep and on my family, my perspective has changed a little bit. I know that when I look at the internet and Facebook, there's two sides to this. And I mean, there's a side that thinks it's a conspiracy and it's nothing. And there's another side that thinks it's the end of the world. And I've always found the truth is probably somewhere in between. So me personally, I want to do whatever I can for Sweetwater County, because again, these are the people that I've known since I was a little kid and I've grown up with and I've fed in my restaurant and that have taken care of me and my business. So I guess that's the perspective I would want to take. And if I could have any statement of what I've said come out of this and anybody was going to print anything, it would be something along those lines that, you know, I'm not worried about what they're doing on the other coast and in the other cities. Let's just take care of ourselves and take care of our people. It's not that I'm not concerned about them because, you know, I mean, there's, as another human being, I care about those people, but they're out of my control and I can make a difference here. And I think each person here, we're not that big of a community, but unfortunately we're big enough to where this is a problem. And so if we can all just make those adjustments where we need to and listen to these people that are, you know, like yourself and Kimberly and these folks that are trying to give us this information, you know, if we just would heed to that, then it would make things better for business owners. I mean, as a business owner, I didn't want to close down for 2 or 3 weeks, but now look, I have to anyway, just because of the situation that happened. Whereas if we all just make those sacrifices to begin with, it seems like they're a lot smaller in the long run and a lot shorter of a sacrifice that has to be made than if this gets out of control. So, I mean, my perspective's changed in that regard, and I just wanted to say that. So I appreciate you guys and all the hard work you're doing and the risk that you put yourself at every day for people like myself, and appreciated by us. Kim, you've been awesome to work with. Jason, you too. And so we appreciate it. Definitely. Thanks for having us.
Thank you so much.
Thanks, guys. Appreciate it. Thank you, everybody. We'll be in touch. Everybody stay safe, stay healthy. Take care.